Good evening, everyone. It's Rob here from Nutritional Europe, and tonight I'm here with Dr. Chris Pickard from Body in Balance, someone I've known for several years, and he's going to be presenting his talk on optimizing blood pressure, which is something that a lot of people are dealing with right now in this current health pandemic. Same as always, if anyone has any questions, feel free to stick them in the questions box, and then I'll come back at the end and ask your questions to Dr. Chris. So, Chris, over to you and take it from here.
Okay, thank you very much, Rob, and hello, everyone. Just like to point out one thing, as is the habit with so many chiropractors in the United States, the word doctor gets put before their name. I am a doctor of chiropractic, not a medical doctor. But you will be learning directly through me from medical doctors, indeed cardiologists. So let's start. Today, I hope that by the end of this presentation, now it stopped working. It's working differently now that we're live. Okay, so I want you to know why you should consider adding nutritional protocols to lowering blood pressure into your clinic. I want you to have multiple options. I want you to have confidence that you can help and a desire to then take some action. Okay, so here I am, Chris Pickard. I'm a Bachelor of Science Chiropractic. I'm a member of the International Association of Functional Neurology, and I am the first UK member of the Cardiovascular Health Institute, trained to be the first holistic heart health practitioner in the UK, and I actually have my picture in the Guinness Book of Records, and that's got nothing to do with health. You can ask me about that another time. Now, when it comes to heart health, there's really three people that have really had a huge effect on how I work with my patients. The first one I sort of really got to speak with was in the middle, Dr. David Dyden. He's a UK cardiologist. He's written a couple of books on the subject of heart health. And when I first met him, he blew me away when he was running late for his appointment with me. And then I was at the end of his day, and he spent the next 2.5 hours asking me about nutrition. And he was absolutely fascinated with it because that's something that he liked to do with his patients. And then on the left there, Dr. Bob Rakowski, that's my left. He is a functional medicine genius. That's all you have to know at the moment about him. And then Dr. Jack Wolfson, he's a cardiologist. His father was a cardiologist before him, and he is my direct mentor for a lot of what you're going to learn today. And one of the books I'd actually recommend that everybody gets is actually Dr. Jack Wolfson's book, The Paleo Cardiologist. This is in particular if you're a chiropractor or an osteopath who's interested in functional health and well-being. This is a fantastic book. You don't have to be a chiropractor to love this book, but if you are, you will especially love it because one of the chapters is all about why people should see chiropractors or osteopaths. Now, the reason I originally got into nutrition as well as chiropractic was because of this man here, my father, with a lovely butterfly on his head. And he's never really been overweight. He's always been fairly active, but not necessarily very fit. But his diet has always been pretty poor. And his diabetes in his 50s, late 50s, was getting so bad, despite following the recommendations from the NHS. He was on the maximum amount of pills that he could have before insulin was actually going to be introduced to him. And he tried straightforward approaches, but nothing was working. And the thing about my father is he hates needles. When he goes to a dentist, if he needs a filling or a tooth out, he will actually go through the pain rather than have an anesthetic. That's how much he hates needles. So that was enough of a motivator for him to actually make some radical changes to his diet and to his nutrition. And within just 3 weeks, not only was his blood sugar under control, he was able to stop his blood sugar medication, but also his blood pressure was so much better. He stopped his blood pressure medication. So when he went back to his doctor after a month of being told you need to go on insulin, he didn't need to go on insulin. In fact, he didn't need any medication at all. Unfortunately, the doctor never asked what he did. He just thought, well, there you go. And since that day, I'm unhappy to say that my father now just does enough to not go on insulin. So unfortunately, he is taking medication for his blood pressure. He is taking medication for his drugs. I don't want to, for his diabetes. I don't want to mislead you, but he knows he can control it, so he doesn't have to have needles stuck in him. Not good enough, I know. Now, I am just going to very briefly cover what is blood pressure for one particular reason, which you'll find out in a moment. It's just in case you don't know, which I'm sure you do anyway. Blood pressure is basically the force of blood against the artery walls. It's recorded as two numbers, the systolic pressure and the diastolic pressure. The systolic pressure is the higher one where the heart contracts, and the diastolic is the lower one when the heart relaxes. And you confirm a diagnosis of hypertension in people, and this is from the, I think this is from the NHS website, when you have a blood pressure of 140/90 or more, and that it's actually been recorded at night or at home, and it's been monitored, and the average is 135/85 or higher. So that's what blood pressure is. Why treat it when it's high? Well, high blood pressure is the third largest risk factor for premature death and disability in England, behind smoking and poor diet. It's responsible for 75,000 deaths in the UK in 2015. 50% of heart attacks and 75% of strokes are due to high blood pressure. It's a major risk factor for chronic kidney disease, heart failure, and dementia. And it gets worse. We are all at the moment in the midst of the coronavirus, and we know from around the world that people with high blood pressure seem to have the highest mortality rates from COVID. And this is really what got me thinking a lot more about blood pressure and wanting to look after patients with blood pressure at the moment. And I was trying to figure out why they were at so much more risk than, say, people with lung disease. And in Italy as well, it's the same. It's high blood pressure is the highest. You can get a copy of the slides. You can check this out later. And the reason why seems to be linked to this. I don't know how much you know about coronavirus, but one of the major reasons that it leads to death is because of what's called a cytokine storm, where basically inflammation goes completely out of control in the body and basically just nukes your body. And blood pressure, in many ways, is related to having an improper cytokine storm. And one of the things that I found was that just last year it was shown that blood pressure may actually be secondary to immune problems. They found out that there's something called endothelin. It's a protein that circulates in the body, and the higher the levels of endothelin, the higher your blood pressure. And the thing that keeps endothelin levels low is macrophages, part of your immune system. And so this is one of the reasons. There's two reasons. One is the cytokine storm, and we'll get back to that later, but also because for some people, blood pressure is secondary to the fact that their macrophages are not working. Very important part of the immune system. So why treat blood pressure naturally as opposed to with drugs? Well, one of them is actually because of the way that it's measured. This is according to NICE, the National Institute for Clinical Excellence, which I think is a bit moronic in this case. And this is straight off of their website. When considering a diagnosis of hypertension, measure blood pressure in both arms. Now, most of the patients that I'm seeing have never had their blood pressure measured in both arms. And here's a silly bit, okay? If the difference in readings between the arms is more than 15 millimeters of mercury, repeat the measurements. And if the difference in the readings between the arms remains more than 15 millimeters of mercury on the second measurement, measure subsequent blood pressures in the arm with the higher reading. Now, this is completely moronic because it could be that they have something that needs surgery to alter blood pressure one side because there's a problem with a vein or an artery, but also it can be neurological, which means that treating the body with a drug when you have something neurological and it's the way the brain is working, it's just ridiculous. And so I'm utterly surprised to see this. And it's, again, another reason why I'm not surprised why blood pressure is such a problem, because they just don't know what to do with it. And then you have side effects. Side effects to the actual drugs that people are put upon, okay? And they're called side effects, but really a lot of them can just be effects because of nutrient depletion. For instance, ACE inhibitors. ACE inhibitors are a major drug used to lower blood pressure. And one of the things that they do, as well as lowering blood pressure, is they lower zinc. And as you lower zinc in the body, this slows wound healing, decreases immune system function, okay? It creates a loss of taste and smell and decreases sexual function as well. Beta blockers. Beta blockers lower coenzyme Q10 and melatonin. Low coenzyme Q10 decreases protection against cancer, aging, tiredness, congestive heart failure. It also increases lipid levels and increases blood pressure as well. And low melatonin can lead to insomnia, depression, growth hormone deficiency, blood sugar changes, decreased protection against cancer and aging. So that's just two. It's not good. And this has led to one doctor that I follow, Dr. Alciers, to saying that beta blockers can lead you to become a fat, lazy, incompetent water balloon. You can come back and read that later when you get the slides. And this is one of my favorite cardiologists, and he's on the news quite a lot at the moment, Dr. Aseem Malhotra. One of my favorite quotes is, "Honest doctors can no longer practice honest medicine. We have a complete healthcare system failure and an epidemic of misinformed doctors and misinformed and harmed patients." And he is forever trying to get people to follow lifestyle rather than medication. And here's another eminent cardiologist, Dr. Christian Barnard. Those of you who are older will remember he became very famous for pioneering heart transplant surgery. But he went on to say that I have saved the lives of 150 people from heart transplantations. If I had focused on preventative medicine earlier, I would have saved 150 million. And he actually went on to try and develop nutritional protocols to save people in South Africa. So treating blood pressure through natural means is not a new idea. It's a very old one, and it's got a lot of support behind it. Now, this is just a little diagram of how complicated all of the things that lead to blood pressure are, okay? And I'm going to skip over that, okay? So you have obesity, you have poor diet, you have dehydration, you have excess alcohol intake, electrolyte imbalances, potassium, magnesium deficiency, too much sodium, inflammation, you have essential fatty acid imbalances, mitochondrial dysfunction. It just goes on and on and on and on. And there's can be secondary to other health conditions as well. And of course, those health conditions can be caused by all of these problems. And then you have food substances, so too much salt, we've spoken about alcohol. Licorice can actually cause high blood pressure. Tyramine containing foods, if you don't have enough of the right bacteria in your gut, or enough fiber, that is, and tyramine is basically meat and eggs. Heavy metals, lead poisoning or slow lead poisoning or accumulation in the body is a massive cause of blood pressure, especially resistant to drugs and ordinary nutrition. Mercury, thallium, lithium salts, and then, and this is a big one at the moment, air pollution. Air pollution is a big cause of blood pressure. And many medications, including cold and flu medicines, and also pain relievers like paracetamol and ibuprofen. There's birth control pills as well, some antidepressants as well. There's a huge list of reasons why people have high blood pressure. And another one is pain. So many people are on painkillers, which can increase blood pressure, but also pain itself can increase blood pressure. And trying to decrease blood pressure when someone's in pain without addressing the cause of their pain is a big problem. And this is one of the reasons why Dr. Jack Wilson recommends everyone with blood pressure problems should go and see a chiropractor. So I've simplified things a little bit here. Finding the cause of your hypertension, Could be a lack of sleep, lack of sunshine, stress, pain, immobility, toxins, and food and drink lifestyle right in the middle. Now, just so you know, this presentation is meant for informational purposes only. The content is solely my opinion based on mentoring from cardiologists, and this presentation from now on is not meant to diagnose, prevent, treat, or cure any disease. Please speak with your healthcare provider regarding any change in your healthcare plan. This is something that I recommend that you speak about. If you are speaking to someone with blood pressure, just let them know that you are trying to improve their health and their well-being, not trying to treat or diagnose their blood pressure problems. So here is a slide that I nicked from Chad Oller, who did a presentation for Nutritional, I think last year. And he shows that dietary changes can make a, this basically says dietary changes can make a difference of 8 to 40 milligrams of mercury, exercise 4 to 9 millimeters, reducing salt 2 to 8, limit alcohol 2 to 6, lose weight 3 to 10, stress reduction 2 to 12, and supplementation anywhere from 5 to 40. So it can make as much of a difference as dietary changes. Okay, but I really hope that sort of makes it clear that there's a lot of natural things that you can do to help your patients, and so many of these things are just not done. And just as Dr. Jack Wilson says, supplements supplement a healthy lifestyle. We are going to be primarily talking about supplements today, but please realize that you need to help encourage your patients to have a healthy lifestyle as well. And supplements, as I've shown already or indicated, they do have an effect by themselves. You can go and look these up later. I'm just going to gloss over these. But supplements to avoid though. Licorice has actually got many uses. It's actually found in a lot of supplements to help with gut healing. And it's because of this one particular extract for it, Glycyrrhiza glabra. So when using a licorice supplement, make sure it's deglycerized, because deglycerized licorice is actually found in a lot of supplements to lower stress. So if you are seeing licorice on a supplement, make sure it's deglycerized. Caffeine, guarana, which is a stimulant like caffeine used in a lot of energy drinks, yerba mate, ephedra, known as mahung, bitter orange in large amounts can be a problem, although bitter orange does have many other benefits. Ginseng, St. John's wort can be a problem, and yohimbine as well, though I don't think we can get that here. So an overall action plan is something that hopefully you're going to be able to put together by the end of this. Chad Oller, he basically puts it into 4 areas, or 5 areas, sorry. Address fats, basically, reduce oxidative stress, modulate angiotensin converting enzyme, ACE activity, support optimal nitric oxide production, and improve arterial elasticity. And you're going to get protocols for all of those. Sorry about this slide, I didn't quite manage to make this one look pretty. Dr. Jack Wilson's blood pressure hit list is decrease salt, decrease caffeine, decrease sugar, very important, decrease air pollution, decrease electromagnetic frequency pollution, primarily light, use blue blocker glasses at night, reduce heavy metals in the body, reduce plastic pollutants and hormone disruptors, get more sleep, get more sun, have more mental health, improve your mental health, decrease stress, and see a chiropractor. And here's my 7 points, okay, to make it a little bit easier. First of all, I like to make sure that every patient is well hydrated. I'm going to cover that in a minute. I like to make sure they have optimal nitric oxide levels. I like to put people on what I call a modified paleo-NO diet. So if you're looking at putting patients on a diet, I mean, Mediterranean diet is fantastic. What's called the DASH diet is good, especially there's a more Mediterranean DASH diet now, which seems to be even better. You can put people on a paleo diet, whether you put them on a vegan paleo or a plant-based with some meats, that's fine. And NO stands for nitric oxide boosting as well. Then there's detox, which we'll get to. building resilience to stress, improving circadian rhythm, so that's the sleep-wake cycle, and then what I like to say called the Goldilocks exercise program, which is just enough exercise for that person. Because some people think that more exercise is better, but it can actually be more exercise that's leading people to nutritional deficiencies, all kinds of oxidative stress and tension, which leads to increased blood pressure. So when I look at people, I actually try and figure out what's the right amount of exercise for them. Today, though, we are going to be covering hydration and something called structured water, nitric oxide, a supplement plan, buffering stress, and then detox as well. I'm going to be trying to speed through things as much as possible because I am very aware of your time, but then you can come back and rewatch the replay and you'll have the slides to this as well, and you can always ask questions at the end or seek me out at some point. So first of all, hydration. I'm just going to have a drink. Hydration is not just about water. Water is actually held in our body by other nutrients. And so when it comes to hydration, whenever you drink some water, have some plant matter as well, whether it's a fruit or a vegetable or even seeds. Yes, nuts and seeds, even though they're incredibly dry and contain really no water whatsoever. When you have water with some plants, it will actually improve your hydration better than taking twice as much water. And if you have patients, or if you yourself are someone that has to continually drink water throughout the day, it's a sign that you're actually dehydrated, because you should only really need water a few times a day. So some people, lots of phytonutrients. These are actually two great products that Nutridyne have. One is just called simply Hydrate. I actually like to use fruits and greens because it's just made from fruits and vegetables, and everybody needs more fruits and vegetables. And it comes in lots of different fantastic flavors. But what I'd really like you to know more about, if you do want to know more about hydration, there's a great book called Quench by Dr. Dana Cohen. And on my website, painreliefcenters.co.uk, water content of a range of foods, I've actually put 3 videos on there, one by Dana Cohen and 2 by some other doctors about water and structured water, because then you'll get to really understand why hydration isn't just about water and is so key to blood pressure. This is a screenshot from one of those videos that you can watch, a cross section through some capillaries. And you can see the cells around the capillary wall on the outside, and then a red blood cell down the middle. And what has been found is that basically the inside of the capillary walls is actually covered in what's called exclusion zone water, or structured water. And structured water is like a gel, and it creates a positive charge, and red blood cells should be negatively charged, apparently. And it's actually this positive charge created by the exclusion zone water that actually allows blood cells to run smoothly down through your capillaries, and also through all your blood vessels actually. And when the structured water breaks down for various reasons, this can be why people then have high blood pressure. And one of the most important things for keeping structured water there is, of course, proper hydration, which isn't just about water, it's also nitric oxide, which we're getting to now. So nitric oxide is a wonderful molecule. I first heard about its use in the body when I was at chiropractic college, my physiology tutor. If you went to the Anglo-European College of Chiropractic, what's his name? Mr. Tyler. Sure, it was Mr. Tyler. Got his name now. Terrible. But he was basically amazed that nitric oxide had just won the Nobel Prize for medicine, and it was found that it helps dilate blood vessels, decrease platelet aggregation, so it therefore decreases blood pressure. And nitric oxide is made from an amino acid called arginine, and it's controlled by a number of enzymes called the nitric oxide synthase enzymes. Okay, and nitric oxide is a signaling molecule. It's not just used to dilate your blood vessels. I think I've got a bit more information here. No, I haven't. I'll have in a moment. But nitric oxide synthase is basically called enzyme 0 in the air pollution-induced vascular toxicity. And just as an air pollution, by actually disrupting nitric oxide, because as you breathe in the air pollution, it actually disrupts the gases and how they are in your lungs. And it then affects the nitric oxide in your blood vessels. And nitric oxide is also needed for your immune system to work properly as well. I think that's the next slide. Here you go. So nitric oxide is needed for your heart to be healthy. It's needed for your immune system to be healthy. So air pollution knocking out nitric oxide, causing high blood pressure and causing problems with your immune system. And the problems it causes with your immune system is nitric oxide helps control the inflammation part of it. Nitric oxide is also needed for your brain to work properly. It's also needed for sexual function as well. So it's kind of a big deal for humans. And here are two great supplements, supplements for helping nitric oxide. One is called CardioFlow, which is actually put together to help improve nitric oxide. It's got a few other great things in there as well for blood pressure. So it's a drink, so it's very easy for people to take. And then there's something called BP Natural as well, which has got some things in it, which I'll be covering in a minute, which again help with the control of nitric oxide, but some of the other factors that help optimal blood pressure control. And BP Naturals and CardioFlow together, especially if you then add this to dynamic greens, is a fantastic, simple formula for people to use to improve their blood pressure. So supplements. I'm going to whiz through some of this. Hey, pomegranates. Pomegranate juice is being held as a kind of wonderful elixir for all kinds of health problems. And one of the reasons is because it actually helps control and improve nitric oxide. It also seems to inhibit ACE activity as well. So pomegranate extract is found in BP Naturals. Then you have curcumin, another spice that people can get into their lives. It's anti-inflammatory, anti-thrombotic, antioxidant, and again improves nitric oxide synthase activity. Then you have grapeseed extract, which is one of the many what are called polyphenols. And polyphenols is one of the reasons why I love dynamic greens, because it's full of polyphenols. And grapeseed extract helps improve vasodilation, because again, it has an effect on nitric oxide synthase. It has other effects as well, including decreasing inflammation. So it's great for helping people in pain. Resveratrol. Again, resveratrol has been hailed as a wonder supplement. It's antioxidant, and again, it seems to have effects on nitric oxide synthase activity. So yes, you find this in BP Naturals as well. And all by itself, it has been shown to decrease blood pressure. Polyphenols, already mentioned one of them, but there are lots of them. This is why the Mediterranean diet is so good, because it's basically has and all plant-based diets are great because it brings more polyphenols into the body. Then specific, vitamin E. Vitamin E can be a bit of a problem, because if you have synthetic vitamin E, it can actually lead to increased blood pressure. This is why it's really important to get natural vitamin E and get it in all of its forms. There's 8 different forms of vitamin E, because when you get it in its proper forms, it does actually help the control of blood pressure. And it is best to take it with other antioxidants, because one, it helps recycle other antioxidants, but also other antioxidants help recycle vitamin E and protect it as well. And then L-arginine, which is primarily, so this is one of the things about a varied diet. Red meat contain, especially today's red meat, can contain so much crud and rubbish and pollution, and also things that cause high blood pressure, but also it's a primary source of arginine, which you need to lower blood pressure as well. So it's often found to be deficient in even meat eaters, but a lot of vegetarians as well. So this is why I love CardioFlow. Coenzyme Q10, this is another big one. There was a study many years ago that showed that if you gave people coenzyme Q10 enough, and they went up to about 600 milligrams a day, it decreased blood pressure. I think it was about 80 to 90% of the participants over 6 months. And as you saw earlier, beta blockers, one of their side effects is they decrease coenzyme Q10, and you need it to actually help your muscles produce energy. Vitamin K deficiency as well is another cause of heart problems and causes aortic calcification and can actually make your arteries less elastic, more brittle. Vitamin D, people are getting more and more aware of vitamin D all the time. It's a massive, massive problem around the world, even in places like California, even in places with sunshine, because you've been told to get out of the sun so much. So now everyone's got vitamin D deficiency, and vitamin D, as we found out, isn't just for our bone health, it's also for our heart, our immune system, our brains as well. And you need it to decrease arterial stiffness. So to decrease arterial stiffness, vitamin K2 and vitamin D, especially together, very, very useful. And also magnesium as well can be very, very useful for relaxing arterial muscles as well, and has been shown to decrease blood pressure just by itself, magnesium glycinate. Now, more list of things that you can look for as well. Natural RAAS, and that's renin-angiotensin-aldosterone system. This is the primary system through which ACE inhibitors work. And then you have things like vitamin D inhibit renin, natural ACE inhibitors, many spices. Pomegranate has actually a number of different ACE inhibitors in it. Parsley, thyme, oregano, mint, chamomile, celery, dandelion, then various vegetables, ginkgo, moringa, black cumin seed oil by itself is tremendous, cocoa, green tea, capers and onions, nattokinase, which again I think Nutritional have a supplement for that. So there's lots of natural things. This is why I love a varied diet. And why I love Dynamic Greens, because it contains a lot of these things. And finally, I think this is the final one, is probiotics. Basically, it's been found that another reason why people have problems with their blood pressure is because of their gut bacteria. And it has been shown that when you supplement people with the right probiotics over the course of 8 weeks, you can get changes, positive changes in their blood pressure. So here is a little protocol to help CardioFlow. Now, CardioFlow contains some magnesium as well, okay? But if you want to make quick changes with people, you can try this all together, or you can try one at a time. CardioFlow, 1 scoop 4 times a day, with or without food. But because of the magnesium, some people have difficulty absorbing magnesium. And so 4 times a day may be too much, and it may mean they get loose bowels. BP Naturals, take 2 capsules twice a day. I think that's written on the actual side of it anyway. The CoQ10, get the ubiquinol form, because it's far more powerful than the ordinary cheaper form. Take 1 gel cap twice a day. N-acetylcysteine, very important antioxidant. It helps to make something called glutathione, very important for detoxification and recycling all other antioxidants. And again, I think it's been shown to decrease blood pressure by itself. 1 capsule twice a day. E-Toco, which is a mixture of all of the vitamin E forms. 1 gel cap twice a day. Vitamin C 500 biocomplex, 1 or 2 to 3 times a day. And again, I like to start people slowly on both this and the CardioFlow, because again, too much vitamin C can cause bowel problems. And then vitamin D3, K2 combined, vitamin D3, K2 5000 is the product. Just 1 gel cap a day, depending on how much sunshine is around and how many brassica vegetables they eat. And also a probiotic. Nutridyne have a number of different ones, just take as directed. So there's a drink and a number of supplements, and monitor people for about 4 weeks and assess them at the end and see if things are improving. And for most people, this should be a good protocol, especially when you mix it with a Mediterranean diet or just more plant-based living and looking at their exercise regime as well. Many people are going to benefit from this. Now, stress. Stress deserves some attention all by itself. And yes, sugar is quite stressy. It does actually raise your stress hormones, which can raise blood pressure. So desserts, even though they're yummy, may not necessarily be good. One of the tools that is at your disposal is something called the Identity T stress assessment. Nutridyne in America have got their own version of this. I think it was actually pioneered by Metabolics in America, but there is a Nutridyne version. Ask Rob about it or just scour the internet. And what the Identity stress questionnaire does is it helps identify which supplements may be best for someone to help them with stress. But just knowing this is very useful. This is actually one of my favorite supplements, Stress Essentials, because it's full of adaptogenic herbs. And the thing about adaptogenic herbs is they're good for more than just what's on the label. So the ingredients of this, also some of them can help balance blood sugar, some of them can help with blood pressure directly as well. And this doesn't make you tired either. So this is great for people living a very hectic, demanding life who forget to take care of themselves. They're burned out, anxious, apprehensive, difficulty sleeping, nervous energy, can't calm down. I actually have this in my medicine cabinet at home because I like varying the adaptogenic herbs I take in my life for a number of different reasons. So I do like this one. Stress Essentials Balance. This contains some different nutrients. This is great for people who are very low energy. Think also you might be aware of something called adrenal fatigue. I've got a bone with adrenal fatigue. That's another issue. But if people are low energy, tired and weak for no apparent reason, they look a bit puffy, they're waking up unrefreshed, this is good. And you can take it with the Stress Essentials, just at a different time. One thing about Stress Essentials, I think it says this on the label, but this is actually best had with warm water or a hot drink because you'll absorb some of the nutrients and you'll activate some of the adaptogenic herbs better. Okay. And then this is a great little product all by itself. Theanine. Theanine is an extract of green tea, and it's one of the reasons why green tea is so very healthy. It's got other extracts in it, like EGCG, but L-theanine is a great supplement for decreasing anxiety. It has been shown to decrease blood pressure by itself as well. And you can take it in high doses. So again, if you're looking for someone who wants to take something as natural, it's very, very safe, very little in the way of side effects, and it can help improve people's concentration, but it can also help people stay asleep when they go to sleep at night. So it doesn't make you drowsy, but it decreases stress and tension. This is one of my favorite formulations because of the repeated feedback I get from patients. It's called Cortisol Pro. It contains some of the nutrients we've already spoken about, including theanine, including N-acetylcysteine, and some other adaptogenic herbs. And for people who are really stressed out, it's actually the first thing I try. Okay, and even just the site, I think it says take 2 a day, but I start people off on just 1 a day. And I have so many patients say that just 1 a day, it makes them feel less stressed and they can cope with whatever life is throwing at them. So I have a very stressed lady working in the NHS and she loves this, okay? And Cortisol Pro will help also people with detoxification as well as helping people with blood pressure, but it's great for stress. And you can take up to 12 capsules a day. So just remember though that some people find that 1 a day is enough, but you can get them taking 2 with every meal or more and between as well. But one word of caution, those who are living on adrenaline may find that they can only take this in the evening because they're so adrenaled up. They're pumping out so much cortisol, they're actually living off of it. And so the moment it's lowered, they are very tired. So when you first give this to people, just tell them to take it in the evening at first. but a lot of people find that they function better throughout the day when they're on it. So as a one-stop shop, this is probably my favorite single supplement that I'll be talking about today. Maybe dynamic greens as well, but when it comes to blood pressure, focusing on it, this is the one, I think. So now I've spoken about taking something lots, let's talk about detoxification. We are massively exposed to lots of toxins, and there are many things I could go on for hours about detoxification and how to do it properly, because you've got to optimize your skin, your lungs, your immune system, your intestines, your liver, and your kidneys. And if you really want to detox, you've got to learn how to detox the nervous system and the brain as well. And there are 5 basic steps to detoxification. First, you have to remove the sources of toxins in your life, but also you've got to remove them from your body as well. You've got to regenerate cell membranes, restore cell energy, reduce inflammation, re-establish a process called methylation. I'm not going to go into all of those at the moment. I'm just going to give you a protocol most people need to get out of a I forgot that slide had some audio on it. Detox protocol. And hopefully that stopped. There we go. So I got that slide from Dr. Bob Rakowski with his 7-day reboot, because he often says that one of the reasons that people are having so much trouble is the fact that their cells are so depleted in nutrients. It's like a car that's stuck in a mud. If it's stuck in a mud, it doesn't matter if you get one person pushing for 20 years, the car is not going to actually move. What you need to do is you need to get 10 or 20 people to push the car out. And this is what a detox does. And so this is a detox that's based on Dr. Rakowski's blood pressure one. There we go. So Dr. Bob Rakowski, his intense detox requires people to have nothing but vegetables in their diet for 7 to 10 days. And then for their protein, they have nutritional metabolic shakes, such as the cardio metabolic shake, which, as you've guessed, is designed for people with cardiac problems, and also the detox shake as well. Now, I like to combine them both for blood pressure problems when they're doing a detox. Then you need something to help heavy metal chelation, to get rid of the lead, that's Nutri-Chel-X. Improve energy, it's on the next slide, and D3K2, very important as well. And I'll go through the amounts. You take extra fruits and greens in forms of dynamic greens. If they're stressed, in fact, even if they're not stressed, if they've got high blood pressure, take theanine. Cellular energy, it contains coenzyme Q10, it contains some other nutrients to help detoxification as well, and blood pressure, and helps decrease cravings. Take some fish oils, take the cardio flow, and this is the probiotic that I recommend people take when they're detoxing, Spore Probio, because it can be taken with food, it can withstand heat, and because of the forms of probiotics and spores in it, it actually has been shown to make massive changes in the entire microbiome, and better than ordinary probiotics. So Spore Probio is the one that I'd recommend. And here is the protocol. I hope you're all staying awake. 1 to 2 servings of cardiometabolic per day, preferably with the dynamic greens. 1 to 2 servings of the detox drink per day with dynamic greens. And what you want to do as a guideline is, because protein is one of the keys to detoxification. Yeah, just going veggie is great. It allows the body to clear out lots of crud and rubbish in some ways, but your liver needs protein in order for it to fully detoxify the system in the body. In fact, all your cells need the protein. And you also need protein to keep your muscle mass up as well, which is very important for sustained health. I hope I'm preaching to the converted here. So I aim with my patients to know what their weight is in kilograms and advise them to try and get 1.5 grams of protein per kilogram, if they can. And so it's very easy because we know how much is in a scoop of cardiometabolic shake, we know how much is in a scoop of the detox shake, and I try and tell them to get at least amount of this. So it could be it could be sort of 1, 2, 3, 4, 5, it could be more than 2 servings a day. of each. And you can mix them together. One's vanilla flavored and it comes in chocolate flavor as well. The other's in chocolate flavor, so you can have them at the same time. But I like to try and spread it throughout the day, and eat as many vegetables as you want. And then for the purpose of the detox, up to 20,000 international units of the D3K2, so that's 4 capsules a day, 200 milligrams of theanine every hour, every waking hour. It may seem a lot, but it's not. The omega 1000 3 times a day. Shell-X, 5 of the Shell-X twice a day. That's actually written on the side of the bottle as well. 1 cellular energy twice a day, and 2 spore probiotic 2 times a day. And then the cardio flow drink 1 or 2 times a day. They can have it more, separate from the cardiometabolic and the detox drinks as well, if possible, although they can have it at the same time. And just be careful for magnesium tolerance, because there is magnesium in the other supplements. Now, this may seem like a lot, and if you've never been through Dr. Bob Rakowski's 7-day intense detox, there's no reason why you can't do a modified version of this, even if you haven't got high blood pressure, because so many people feel so much better afterwards. Their performance improves. So if there's a lot of fitness professionals watching at the moment, try this. You will be amazed at how much faster you are and how much more you can lift. Okay, and the idea is to not go hungry. Eat as many vegetables as you want and have lots of protein. Okay, so is that, yes, so that I think is it, isn't it? Yes, I have got to the end. This is a summary now. This is my overall sort of map of how I like to approach people's general health. Health there, optimal health being at the middle, optimal health and immunity, high energy, clear thinking. I like to think there's 3 main systems in the body. There's the body, so the musculoskeletal system, there's the bowels, there's the brains and the nervous system. And these are protected, okay, by us thinking right, talking right, that's internal and external communication, drinking right, eating right, moving right, detoxing right, and sleeping right. And these are what are called the Magnificent 7 health strategies. And that's straight from Dr. Bob Rakowski. That wasn't me who came up with that. And these help protect your body, brains, and bowels from stress, toxins, and trauma. So if you want to use that diagram, use this analogy in any way, but it's all from Dr. Bob Rakowski, modified a bit by me, the Magnificent 7 health strategies. And here, and the Magnificent 7 for blood pressure, which is hydrate, optimize nitric oxide, have a modified Mediterranean diet of some kind, basically have a plant-based diet, okay? That is the key, with a lot of variation. A detox of some kind is fantastic. Build resilience to stress. There's all kinds of mental techniques that can be used, breathing techniques, there's so many. Look at optimizing circadian rhythm, getting plenty of sleep, and then there's the Goldilocks exercise program. There we go. I did it. Rob said an hour. I sped through things I know. So now I have sped through that. I hope you're not too confused. I hope you're now thinking, I can't wait to get the slides so that I can go back and start implementing some of this. And I will just leave you with one thing. It's okay to ask for help. So if there are any questions, Rob, it's back to you.
Hi, Chris. Just a couple of questions we've got. One of the questions is, can CardioFlow be used as a pre-workout supplement or during workout supplement?
Yeah, anything that is going to help dilate blood vessels, and arginine and improving nitric oxide, yeah, it can be a great thing to try. I haven't actually tried it myself as a pre-workout drink, but yeah, it can be. Let me know how it goes.
I might be able to answer this one. Which multivitamins are best combined with CardioFlow for general health or to increase peripheral circulation? We do one called Essential Multi. So you've got a very good amount of vitamins and minerals. You have very well absorbed B vitamins such as methylated B9 and B12. And not only that, you have a real comprehensive phytonutrient blend within the multi. So I think you alluded to it earlier, Chris. about the importance of different phytonutrients, I'd probably say that multi-nutrient is one of the best ones.
Yes, it is. It does contain, which is actually why I mentioned this actually, it does contain a small amount of bitter orange, which has been shown to actually increase blood pressure. But bitter orange in the small amount that it's going to be in that, and because it's mixed with other nutrients, it's going to help, because bitter orange can be very, very helpful for actually decreasing stress and improving sleep. So the way it's formulated, it's not going to be a problem.
And finally, what about an exercise program suggested? Do you have any favorite exercise programs, Chris, for decreasing blood pressure?
It really does depend on the individual. But generally, what I like people to do is to do small bouts of exercise for just a few minutes, multiple times throughout the day, and use as many of their limbs as possible. Because the more movement you have, the more it has a neurological input to the brain, so it decreases stress. And so you want to do this multiple times a day. But also, when you exercise for about 2 or 3 minutes, it's enough to flush nitric oxide that's in your artery walls into your bloodstream. And then if you wait about 3 or 4 hours, your arterial system would have built up nitric oxide again, and you can do it again. So I have actually, and there are a number of videos online saying this is the nitric oxide boosting workout, but pretty much any movement where you move as many of your limbs as possible for about 2 or 3 minutes and get a little bit out of breath, that's going to help. And so if people are exercising lots and lots and lots, I don't recommend they do that to decrease their blood pressure. It's got to be small amounts and often.
And I'll just add to that, when we did host Shadow last year, he did mention to kind of pay attention, if you like, or don't overdo the interval training too much with people with high blood pressure. So just maybe bear that in mind when prescribing exercise programs.
Yes, just not massively intense. Yes.
Yes. So that's it in terms of questions. So Dr. Chris, I'd just like to thank you very, very much for all the information you've given us today. Thank you to everyone that's attended, and we will see you soon.
Thank you.